Bruise at the slightest bump, paper-thin skin on your forearms, those purple patches that seem to appear out of nowhere. Let's try something different today. Not another cream, not another bandage. Inside out repair. What you eat regularly, simply, can make your skin less fragile over time. I will show you how to build that from the plate up and how to pair it with a couple of smart outside surface habits so that you can actually see fewer tears and gentler bruises. I'm Dr. Chris Ho, skin cancer physician in Brisbane. This is part of my Fragile Skin series. If you're new here, video 1 covers the 5 daily basics: sunscreen, moisturizer, gentler handling, better nutrition, which is this video, and hydration. Video 2 shows protection tools, soft sleeves, thin silicone second skin sheets that are tailor-made, clinical grade, mild compression, and my micropore tape trick. Today, however, we go inside. Food first, no hype, just better nutrition habits. Start with protein. Most older adults don't eat enough, especially at breakfast and lunch. Protein is the building block for collagen and for tiny support structures in your blood vessels. If the scaffolding is thin, the skin tears. Aim for palm-sized serve at each meal. Simple, chewable, everyday food spread out for breakfast, lunch, and dinner. These are eggs, Greek yogurt, fish, cheese, or beans, chicken, tofu, or lentils. If appetite is small, split it, little bits and oftentimes. The goal is to be consistent. Then layer it in vitamin C. It's the co-worker that helps you build collagen properly. Think 1 or 2 bright colorful foods a day. A kiwi, some berries, a wedge of citrus, half a red capsicum in your salad. You don't need megadoses. You just need it daily. Small regular supply beats one big tablet. Add zinc, the quiet helper for healing. You'll find it in seafood, lean meat, or chicken, nuts, seeds, and legumes. If you rarely eat those foods and your skin tears are slow to close, a short, simple zinc supplement can be reasonable. But first, food is the main intake. Hydration. This matters more than it sounds. Dehydrated skin is brittle skin. Keep a glass or bottle in sight and sip through the day. Tea, soups, and other fluids count too. And don't fear healthy fats. Healthy fats include olive oil, avocado, a few nuts, or a full fat yogurt. Help the skin barrier do its job. If weight is drifting down, add calories you'll actually eat. A drizzle of olive oil, a spoon of peanut butter. This is repair, not restriction. A quick word on alcohol. It can make bruising look worse and slows healing for many people. If you're bruising easily, try trimming it for a few weeks while you build the inside out plan. You may be surprised how much difference that one change can make. A brief note on outside in, the armour. Some of the names overlap with food. Vitamin A, B3, C, E, hyaluronic acid, even collagen creams. But they work differently on the surface than they do inside. Moisturizers with urea, glycerin, or ceramide, they pull in water and rebuild the barrier. Hyaluronic acid plumps if you seal it with a cream. Niacinamide, vitamin B3, the skin vitamin. B3 5% in creams helps the barrier and redness. Retinoids, vitamin A, can slowly nudge your collagen to revive itself, but go slow. Collagen creams comfort, but don't deliver collagen into the skin, into the dermis. Oils can help as a top seal, non-fragrant option, and eaten in small amounts when weight is low. If you want the full tour of the outside inside, that's down my alley. Skin and skin cancers. I've got videos on that. The different vitamins you take orally, you can also feed your skin from the outside. Pairing inside with outside. Keep a bland, rich moisturizer once or twice daily. Anything with urea, glycerin ceramides, or vitamin fortification is fine. Moistured skin flexes, dry skin breaks and tears. For chores, gardening, or supermarket bumps, light forearm sleeves are the easiest use that I know. If you want full protection kit, sleeves, thin silicone sheeting, barrier films, compression stockings, watch video 2. I go step by step through how to use each. What should you expect? Not overnight miracles. You are rebuilding materials, not patching up cracks. Give it a few weeks to notice fewer bruises and a few months for skin to feel less tissue paper thin. Take a quick phone photo of your forearms today and compare it again in 6 weeks. Small changes are easy to miss unless you look for them. Here's your simple checklist for the fridge. 1. Protein. Protein at every meal. Eggs, yogurt, cheese, tofu, beans, chicken, and fish. 2. A daily dose of color to brighten up your daily life. That's vitamin C. Green, yellow kiwis, blue, red, black berries, yellow, orange citrus, and the rainbow colors of all the capsicum. 3. Zinc-rich foods a few times a week. These are in seafood, legumes, nuts, seeds, and lean meats. 4. Moisturize daily and sleeves for bumps. So these are in my first 2 videos. And 5. Your hydration. Drink water, trim the alcohol. That's it. 5 habits done most days beat 10 products done once. If you're on a blood thinner or have a poor appetite, keep your doctor in the loop as you make these changes. And if your bruises are suddenly large, painful, or bleeding from gums or nose, that's not a nutrition project. That's a medical review promptly. Inside out repair isn't glamorous, but it's powerful. It respects how skin truly heals. Steady materials in, gentle protection outside, and patience. If you haven't watched the first 2 videos, start there. Video 1 gives you the basics, video 2 adds the protective gear, and then come back here and let your food do its quiet work. Feed your skin and let it show you what it can do.